Hello, my name is Alison Schofield and I'm a tissue viability nurse working within the NHS. Together with Eleanor, we have produced some short videos to assist in the self-management of lower limbs and leg ulcers. This involves skin care, how to apply a dressing and how to apply different compression systems. We are now ready to reapply our compression hosiery. There are 3 simple steps to this, so we'll talk you through them. So the first step is prepare the hosiery. I'm going to use this hosiery kit, and the same principles apply whatever type of hosiery you are using. So in the preparation, we're going to take the hosiery. So this is my liner of my hosiery kit I'm going to apply first. So the first thing, I'm going to place my hand inside the hosiery, and I'm going to find the heel section, and then I'm going to pinch it, just like this, pinch it gently. Then I'm going to turn the hosiery inside down, like so. I'm doing that, we can see the toe section is nicely tucked inside there. So this is where we now apply the hosiery, stage 2. So we're going to put the hosiery over the toes like that, so the toe section is now nicely in place. So now we want to pull the hosiery over the heel, up the foot, over the heel, and then up the calf so it stops below the knee. So nice and gentle. The heel section's in place, and then that can be adjusted up the leg. As this is a hosiery kit, it has a second layer to it. This one has an open toe, it may be that you have a closed toe too. So again, we're going to do within our preparation, I've put my hand inside the hosiery, I found the heel, I'm going to just gently pinch that and then turn the hosiery inside out. Okay, so I'm going to do the same principle, I'm going to apply this over the toes and then pull up the leg. The second stage is to adjust the hosiery, so make sure it's nice and smooth, make sure the heel's not in place and comfortable, and then the toes you can adjust and just make sure that the toes are not constricted in any way. Okay, so prepare, apply the hosiery and adjust. And now ready to go.